What if your lungs could remember every infection they've had and refuse to let it go? Imagine each cough carving a permanent scars into your airways. That's the story of bronchiectasis, a condition where your lungs hold on to the past and keeps haunting the future. By definition, bronchiectasis is the irreversible dilation of the bronchi, which is caused by repetitive cycles of infection and inflammation. Think of it as a stretch mark inside your lungs. Only instead of being harmless, they trap mucus, grow bacteria, and trigger chronic cough. Bronchiectasis isn't picky. It can result from many conditions, most commonly caused by severe childhood infections like measles, pertussis, or pneumonia. Cystic fibrosis, which leads to thick mucus and repetitive infections. Also in immune deficiencies, for example, the primary ciliary dyskinesia. Something to note is that every obstruction, which as little as a tumor or inhaled foreign body, and sometimes it could be idiopathic, where the causes are unknown, but the damage is all real. So how does bronchiectasis show up on the patient? First, you notice a chronic productive cough. It could be for days, weeks, months, or even years. And this cough often comes with a copious purulent sputum. Secondly, you have recurrent chest infections that keep coming back. This could lead to breathlessness and wheeze, especially as the damage gets worse. And in some cases, there could be finger clubbing. You know those bulbous fingertips that signals long-standing hypoxia? Yes, that's it. Each flare-up is like eating a replay on the damage, making the log worse over time. Investigations. Well, the diagnosis usually starts with a clinical suspicion. The chronic history of a chronic cough and sputum. The gold standard test is a high-resolution CT scan. This shows some classical features, one of which is called the signet ring sign, and the other one which is called tram track lines. To get further, sputum cultures can also help to guide antibiotics therapy, while blood tests take a look for underlying causes like immune deficiencies or cystic fibrosis. Bronchiectasis doesn't have a cure, and at the same time, it can't be reversed. However, it can be managed perfectly. Physiotherapy plays a central role, which involves chest clearance techniques to help shift mucus, and antibiotics, which helps to treat and prevent further infections. Where COPD and asthma overlaps, bronchodilators and steroid therapy may be very helpful. And for selected cases, surgeries or resection of a severely damaged lung lobe could be the solution. Most importantly, patients are supported with vaccination, pulmonary rehabilitation, and long-term follow-up to keep them out of the hospital. So, bronchiectasis is more than just a lingering cough. It's a cycle of infection, damage, and disability. But with early recognition, physiotherapy, and good medical care, patients can live fuller lives. Remember, lungs don't forgive easily. So, every infection matters. Keep them healthy, keep them strong, because once the damage is done, the lungs never forget. That's all about bronchiectasis for today. Thank you for sticking around. See you in the next one. Bye.